That's right. According to Dr. Wesley Williford, while there are no confirmed measles cases in the state of Alabama, obviously health officials at this time are very concerned about the possibility of an outbreak of the virus. Now, they're also encouraging parents to make sure their children are up to date on their vaccines. According to the Alabama Department of Public Health, measles is a highly contagious viral respiratory disease. Measles may live up to 2 hours in the air or on surfaces after an infected person coughs or sneezes. ADPH says the best preventive measure against measles is receiving the measles, mumps, rubella vaccine, also referred to as the MMR vaccine. Dr. Max Hale, a pediatrician with Birmingham Pediatric Associates, is entering his 28th year of practicing medicine. Here's what he had to say this afternoon about the reported death of the unvaccinated child from measles in Texas.
It's very disturbing. It's the first measles death we've had in this country in 10 years. Preventable, certainly.
We asked him about the death rate for measles cases.
The death rate per identified case is going to be somewhere between 1 and 3 per 1,000 in the population. The death rate is higher in some segments of that population, including people who are immunocompromised, pregnant women, and children under 5.
Vaccines are incredibly safe, especially when you compare them to the known effects of being infected with these viruses. These are deadly viruses. These can be deadly viruses, unfortunately, as has been shown in Texas. We don't want to see that. We don't want anyone dying from something that's completely preventable.
Dr. Wesley Williford is the medical director for disease control with the Jefferson County Department of Health. He shared with us this graph which shows the drop-off in reported measles cases in the U.S. after the vaccine became available. He addresses vaccine hesitancy, which state health officials say contributes to increased susceptibility.
There's been a lot of misinformation, particularly around autism, that came out several years ago, and I think that has driven a lot of it. The study that claim was based off was proven to be falsified. The person who wrote that study, they falsified their data and lied, and that has created a tremendous amount of concern and skepticism about these vaccines.
Now, according to the Jefferson County Department of Health, 1 dose of the MMR vaccine is 93% effective against measles. He said that 2 doses of the MMR vaccine are 97% effective against measles. Reporting live in downtown Birmingham, I'm Amy Heibel, CBS 42 News.